Welcome to this, the final policy exchange event of conference. Thank you for coming. I know it's sort of late on in the day, but it should be a stimulating discussion nonetheless. We're asking the question, should social care be funded by the state or the individual? And I'll just very quickly introduce the panel. From the right, my right, Warwick Lightfoot is the head of economics at Policy Exchange and takes the lead on our social care research. Camilla Tominey, Telegraph associate editor. Bob Blackman is the MP for Harrow East and a former leader of Brent Tories, I think for 20 or so years, I think that's right? 20 years. Then to my left, Benjamin Barnard is a researcher, and he's been doing some work this summer for Policy Exchange on social care and particular focus on technology and what technology can do for social care. And then last minute addition to the panel, we're very grateful for her for joining, Julia Lepoidevin, if I've pronounced that right.
Yes, that's fine.
A councillor in Coventry on the Shadow Cabinet. She's a member of the Shadow Cabinet for children and young people. So I thought I would sort of briefly explain why I got interested in social care for 30 seconds or so. I am a journalist by background. I was working at The Spectator last summer during the election campaign, and when the Tories launched their fantastic social care policy, I was having an argument with Fraser Nelson, the editor of The Spectator, and I said, the trouble with this, Fraser, is it's basically a tax on dementia. People who have long-term illnesses will get looked after by the NHS, and people who need social care for a long period of time, complex needs, will have to pay a tax. It's essentially a dementia tax. And Fraser said, you know what, you should actually write that down and publish it. So I did. So I did that afternoon, and the rest is history. But it's easy, with the greatest respect to Camilla, it's easy sometimes to mudsling from the sidelines. And I've moved to. No, of course not. I've moved to Policy Exchange in an attempt to redeem myself and perhaps help come up with answers rather than sort of demolishing other people's policy ideas. But anyway, without further ado, I'll if we start at that far end with Warwick, and I'll give each speaker about 4 or 5 minutes of remarks, and then we will open the discussion, and I'll ask some questions of them as well.
Well, I think social care and its funding is probably the most critical practical policy issue that confronts the government at the moment. Leaving aside Brexit, in terms of the long-term public services and their evolution, I think it's the most pressing issue we've got, and it's quite right that Policy Exchange should actually put on an event, and I'm very grateful for my colleagues actually bringing this together. I also think it provides the Conservative Party with a genuine political opportunity, and at this stage, I think it needs a political opportunity to actually score some runs, and it needs something of a game changer. The challenge for social care in modern Britain arises from really two things. The first is that the balance between funding for medicine, and acute medicine in particular, and the chronic conditions of older age, such as rheumatoid arthritis, the management of a diabetic leg ulcer in the community, or social care when someone needs to help you get washed, dressed, manage incontinence, that balance between the acute care inside a hospital mainly, and social care and these other chronic conditions of older age has always been out of kilter. And acute care has got too many of the resources, and these other chronic conditions have been Cinderellas, and the biggest Cinderella of them all has been long-term social care, whether it's in your own home or in a residential or nursing home setting. And there's a further amplification of this that arises from the way the two services are funded. Any medical care that you actually have, however serious or however trivial, is completely funded through the taxpayer, free at the point of use. So I have a ganglion cyst here, if I have that operated on, and lots of doctors love getting at ganglion cysts, but the occupational therapists say don't let them go there, that will be totally free. If, however, I were to slump in front of you, have a stroke, and need a lot of very expensive, very serious social care, I will be in the hands of my own resources until they're exhausted, and I'm down to some £23,000. And that goes to the heart of the original foundation of the 1940s welfare state, when the National Health Service was set up, and it was decided that healthcare would be free, but anyone needing social care provided by the local authority would have to be charged under an astringent charging regime laid down in the National Assistance Act 1948. That makes it very, very difficult for the services to cohere. That's the reason why so many people are not able to leave hospital very easily. That is why so many people do not get the right form of care, so that you don't have the preventative work that is actually done, and they find themselves going to hospital in a disorderly way, and what was going to be an expensive and difficult matter to manage becomes much more expensive and difficult to manage. One of the things that's very odd about the UK approach to these things is that if you examine public policy in the way they do in the United States, you pick off what would you expect an individual to pay for themselves, what should they expect a private insurance to do, and what should the state do. And because healthcare is such a more difficult issue in the States, they've got a more sophisticated debate than the one we actually have here in public policy terms. And the balance of that debate concludes that where individuals can pay, they pay for themselves. Where they can take out insurance, they take out the insurance. But where you can't, the state pays. So the state pays for the long-term chronic conditions of old age through Medicare and Medicaid. So the state, the public sector, pays principally for long-term care in the United States. Most states, through Medicaid, actually exempt the main home from the means testing regime. Now, I was a special advisor of the Treasury for many years, and for many years I was a member of a local authority and the chair and a member of a social services committee. And we've got to a stage where we cannot make social care cohere with health. Many more households are going to be drawn into this astringent charging regime, and many households are going to be extremely annoyed over it. It's going to become an increasingly politically difficult issue. I believe there's an opportunity for the Conservative Party to recognise that it's going to actually have to pay for long-term social care, as with other forms of medical care which are much less serious, and they're going to have to put more money into care that we already pay, which is about 60% of the people who receive care at the moment. And the opportunity the Conservative Party has is to take away the fact that so many people do not trust the Conservative Party with the welfare state in general, and the National Health Service in particular. I've seen enough public spending challenges in the Treasury to know when the Treasury is going to lose one. And in the long term, either a Conservative or a Labour government is going to concede this. And my advice to the Conservative Party is to actually seize it themselves, address the practical problems, and score the political runs to take that issue to themselves, because in the state of public policy at the moment and politics, the Conservative needs a new audacious tune, and this is not the moment for either half measures or reticence or caution. So I think it's an opportunity for the Conservative Party and an opportunity to right what I regard as a very serious social wrong.
Thank you. Camilla.
Well, obviously social care is of massive importance and interest to Telegraph readers, and I think largely because they may be of the baby boomer generation who have come to the recognition now that they probably haven't saved enough for their own care later in life because people are living longer, and equally because they foresee problems for their children and grandchildren moving forward in having to fund, if not their care, then the children and grandchildren's own care themselves. So that's obviously a significant concern. I have a private interest in it anyway, a personal interest, because my father, who's a retired GP, worked for the NHS for more than 40 years, also runs a private nursing home in St Albans, a very high-end private nursing home, probably the kind of nursing home that, dare I say it, Telegraph readers might like their relatives to end up in for end-of-life care. And sometimes those sorts of nursing homes don't get a good press because they're perceived to be extremely expensive, and they sometimes are on the receiving end of bad reviews of care homes that aren't doing as good a job as my father's. And my father's key refrain in this is that he is getting referrals of patients who could qualify for some council funding, some local authority funding, which absolutely does not meet their needs. So the council funding will really be trying to address a patient with complex nursing needs that doesn't just need residential but complex nursing care, and frankly it wouldn't be enough to cover that patient in an Airbnb for the week locally. That is a concern. Also, on top of that, there is a concern about council funded in the home care, because what we've seen in recent times is hard-working care assistants on about an average of £10 an hour doing an extremely difficult job, providing extremely intimate care in the home, getting people out of bed, getting them dressed, toileting them in an extremely small margin of time. And if you actually think about this whole idea of 15-minute care packages, and you look at how £10 an hour breaks down, and you also consider the fact that those care assistants are often having to drive themselves to the next appointment and pay for petrol, you do the math and you think, how much are they making for that 15-minute slot, £2.50, take petrol out and everything else, and they probably overrun. They're only making enough probably for a cup of Starbucks coffee an hour, which is an unacceptable way to be treating the people who we are ensuring might look after our nearest and dearest. Historically, this has been a nettle that has consistently not been grasped by government. And as we saw with the reaction to the so-called dementia tax, actually I think the statistic is that only 1 in 5 or 6 people will ever have to sell their home to pay for care. But you have policies, as we did in the last Conservative manifesto, which made 6 out of 6 people think they had to sell their home for care. And it was treated as if it was a bitter pill for voters to swallow, but they'll swallow it because this is the harsh reality. And actually, I do, and we're going to discuss this more further, but the question is about self-funding versus state funding. And the chap here at the beginning of this panel was saying, it needs to be a combination of the two. We recently had Matt Hancock talking about auto-enrolment, but that doesn't cater for people who are self-employed. It doesn't cater for women who stay at home, because, of course, you need an employer to auto-enroll you, theoretically. And, of course, it doesn't cater for people like my father, who are the baby boomer generation, who are already partially retired, and they can't be auto-enrolled into anything. So if I think of it from I'm Generation X, not millennial, but with my 40-year-old hat on, when we get a mortgage or when we have to sign up to life insurance, then we're asked whether we want to take critical illness cover. With all things considered, it's now time to ask my generation and those younger whether they want to take up care cover as well, to have a patch of their insurance that is covering care in later life. One hopes one doesn't need it, but one needs it as a security blanket to fall back on. And interestingly, recently, and it hasn't run in the Telegraph yet, but I won't give too much away from the interview I recently did with former Pensions Minister Ros Altman. She's been advocating a care ISA that has got tax benefits to it, so it incentivises people to save into it. It could be IHT free, so it could be passed down from generations. If you're lucky enough to have saved this pot of money, but you've not needed it for care, then you can pass that down without any tax implications at all to the next generation, so all families have a care pot. And I think it really is those kind of thinking out of this box solutions that are needed here, as opposed to what seems to be a great deal of rhetoric about how terrible the care time bomb is, but no real solutions to address it.
Thank you very much. Bob.
Yes, well, my war story was when the manifesto was released last year. A journalist from the Evening Standard, who I knew very well, phoned me up and said, have you read the manifesto? Well, of course, as an MP, we don't ever see the manifesto, let alone approve it. And had we done so, I think there would have been a few changes. And when the so-called dementia tax was part of it, what was my reaction? So I said, well, the first thing we've got to do is put a cap on the total amount that anyone has to pay, as per the Dilnot report. Half an hour later, I had the chief whip on the phone saying to me, you've just given an interview to the Evening Standard countermanding our manifesto saying we should have a cap. So I said, yes, because we've got to have one. No, we're not going to have any cap. No. Well, of course, by Monday, we'd got the cap. The other thing that, well, you didn't mention is I've sat on the Housing, Communities and Local Government Select Committee since I've been elected 8 years ago. We've just recently done a joint report with the Health and Social Care Committee. Now, given that our constraints to try and achieve consensus, I think we've come up with some solutions around this. It's difficult to get consensus across the political parties on this particular issue, but we've got some solutions on it. And I think we all need to understand not just the crisis that's going to take place for individuals, but also for local authorities. And the reality is that had we said in our manifesto, we will quadruple the amount of money you can keep before you'll get charged for your care, actually people are going, oh, that sounds pretty good. And most people don't realise that it's 23,000, and after you've got £23,000 in assets, you're going to get charged for your care. And this is one of the big problems. So a lot of the people that went through it, with respect, people of your generation who are looking after elderly relatives, will be saying, well, actually, that's pretty good, because we know that that will be better for us. But it was presentation as being very bad. We've created a perfect storm because, as you were saying, one of the problems here is that care workers are amongst the lowest paid workers in the land. George Osborne, when he was Chancellor, increased the amount of money that people would be getting. But of course, most people that run care homes then deliver their service to local authorities, and local authorities weren't given any extra funds to provide for the pay that we were asking care homes to provide. So that created a problem, and most care home owners in this country, certainly those that have got 80 beds or less, are desperate to sell them because they can't make any money because of the tight constraints on local authorities. And the other big issue that is affecting this whole problem is on local authorities. We are moving in a direction whereby local authorities will be funded by the charges they can make, by the business rates, and by council tax. There'll be no grant from government. Now, as we move to that, those authorities that administer adult social care are getting to the point whereby 75% of their income is going on adult social care. So effectively, the entirety of business rates, so what businesses are paying for, is adult social care. Well, that is nonsense in this country, and we have to make some radical changes to that whole process. Because otherwise, as people get older and they need more care, we are going to face this constant challenge of what is healthcare and what is social care. And actually the crossover, having served and had political battles with the CCG in my area over what should be funded by the local authority, what should be funded by the health service, basically both areas end up in debt. They just can't administer these things. And at the same time, people are being charged an absolute fortune to be in care homes. Because after all, by definition, if you're in a care home, you need 7 by 24-hour care, and that's expensive in terms of the resourcing and the quality, and we expect good quality as a result. So the challenge for us, I think overall, is not just the funding, but it is the quality of care that we provide, trying to make sure that people can stay in their own homes for as long as possible. Then having a system whereby we have to make some choices on how we fund it. And I think I'm taking the view that for younger people, we've got to try and bite the bullet on this and try and implement a system of insurance. For older people who may have assets already, one of the problems that we have is that the Chancellor, for example, certainly George Osborne, has successively reduced how much you could save in your pension from 1.8 million, it's now down to 1 million. Now, that sounds like a huge amount of money, but actually why don't we have a pot that has for adult social care, that you can save for adult social care and exempt it from tax? That, I think, in many ways, would start to encourage people to do precisely that. But doing nothing is not an option, and we have to grasp the nettle.
Thank you very much. Julia.
Right. Adult social care is not my brief. However, I have had previous experience of adult social care with both my mother and my mother-in-law. So I understand the actual personal difficulties that are going on the ground, dealing with between the hospital and your local authority on social care. It is so difficult. And it's so difficult when you're the actual person that's sandwiched between the younger and the older person, trying to get this sorted. I'm currently dealing with a resident on my ward whose husband is in residential care. He's got dementia. She's spent £64,000 now on his care. She's got a very small, modest home, and she needs him now to go into local authority care because she needs to live herself. She's 80. From my perspective, I believe we need to look at all the options. I think we need to look at insurance, taxation. I think our public need a much better understanding of the current demand, the cost of services. I would also like to see this be a cross-party solution that is found. Life expectancy has increased along with life-limited conditions, and to find a way of funding this adequately, I believe we really need to have a conversation with the public, with a clear understanding, and really that's all I've got to say at the moment.
Thank you very much. Benjamin.
Not so well. Thank you for having me on this panel. I suppose that the area I really want to focus on is something that's been mentioned in passing, but hasn't really been explored so far on this panel, and that's the area of technology. All over the world, we hear about technological solutions to social care problems. If you're in Japan, 8% of social care homes have introduced some kind of lifting procedures through technology, things like Tree, which is an arm that can lift people into beds, or Cyberdyne's HAL, which is an automated exoskeleton, a hybrid assistive limb that can help carers carry people into bed. And if you're in Norway, they launched in 2013 a national programme for personalised connected care. And basically, all over the world, people are looking at technology for the solution to social care problems. And that's great. But I would say three things. And first thing I would say is that though technology might make a massive influence and might keep the costs down and massively increase the productivity of social workers and people involved in social care, actually it's not going to be the answer. Until you deal with the problems that have been outlined very articulately on this panel about the fundamental incoherence between the systems, the relationship between self-funding, and actually really going down onto the ground and seeing the relationship between the local authority and the care homes, you're not going to be able to make all of these massive problems. The second thing is that we can talk till we're blue in the face about the kind of really clever technological solutions that can solve these problems, and the technology may well exist. But that doesn't really matter unless we can actually implement it on the ground, unless we can make sure that that technology is adopted. And so one of the things we need to think very clearly about in the long term from a policy perspective is how we can get politicians and how we can get businesses to start either creating this technology and then implementing it on the ground. So looking at the infrastructure capabilities you need, looking at the data that's being produced, and looking at how this is actually implemented on the ground. And the third thing I really want to focus on is what problems, from a UK perspective, rather than that of Japan or Norway, this can actually solve. I mean, I actually think there are a number of areas where technology in particular can help out from a UK perspective. Firstly, in the UK, we tend to prefer care that's provided in-home rather than residentially. We like people generally to be able to stay in their home setting and to be able to do that through things like monitoring devices, through things like assisted video chats, and through things like that, we're going to be able to have a much better system that enables us to have more care at home. The second thing is that we're actually very, very reliant in the social care system on people voluntarily topping up the state's procedures. So one of the things I think is very lost is that it's very well saying that somebody's in long-term social care, but if they have a doctor's appointment, very often they're reliant on a family member to drive them to the hospital. Or if they are reliant upon a family member to, change various, nappies and things like that in the case of incontinence. And one of the things technology will be able to do is relieve the burden on voluntary top-ups of the social care system in the long term. And there are a number of very interesting technologies that can do that. And the third thing I'd say that's very, very important is that we can coordinate services much more efficiently. So if you have huge amounts of data coming in about the different areas in which this might work, you can do that. And the fourth area I think is very interesting is the area of fintech and saving. So my generation generally save and bank in a very different way to people in the future. And actually there are a number of very, very interesting tech startups at the moment that are focused around getting people not just to save in the short term, but also to save in the long term. And I can see a situation in which young people who are more aware of what these technologies can do for them in the long term, saving and implementing that kind of technology. But I'd also say that there are some really, really interesting healthcare services that are being used to that end. So, for example, in America, Uber have launched something called super carers, which is essentially the Uber of social care, which matches carers and potential carers with people they're actually meeting. And they've partnered with Uber to allow those carers to have discounted rides on Uber. They've partnered with them to basically make sure they have subsidised transports and access to Uber's business platform. And what that means is that when people need to go to hospital at very, very short notice, they can use the app. They know that it's not going to be very, very expensive. And it's a really good example of technology platforms coming in and helping solve this. And the other, perhaps even better example is Babylon. Babylon is an amazing app that anybody here can download at the moment. Essentially has 4 functions. It gives you online consultations. It allows you to monitor your conditions. It gives you different ways of testing your healthcare and the things that are happening at the moment. And it also enables, through AI-enabled technology, for you to chat with somebody to talk through these issues. Now, it was founded with relatively little money, it has to be said. It had £25 million worth of funding in round A, and then got a further £60 million in 2016 to develop its AI technology. It was launched in Rwanda, and after it's a British company, but it was launched in Rwanda quite recently. And after just 6 months, 8% of the Rwandan population was using it, and after 2 years, that's risen to around 33%. And what's very interesting about these AI-enabled technologies is once you've developed the algorithm, it becomes more and more and more accurate as more data gets put in. And that tends to mean that these things can scale up much more quickly. And so if you have somebody who's very lonely, they could be chatting with somebody. There's a robot called Pepper that you often see that helps solve loneliness. But once you've developed those algorithms, it's actually very, very easy to scale up. And in the particular circumstance of Babylon, not only have they teamed up with Bupa, which will lead to interesting things in the future, they've also just partnered with WeChat, which gives them potentially in the future, in China, 1 billion users to start generating this data and providing social care. So there's a lot of problems, there's a lot of solutions that can come from technology. But as I said before, until we deal with the fundamental issues that were designed, that were very, very neatly diagnosed by people earlier on the panel, this is going to be irrelevant. And we need to be thinking as policymakers and as people discussing policy, how it is that we actually implement these technologies and encourage people to invest in them. And unless we can do that and get it working on the ground, nothing's going to happen.
Excellent, thank you very much. I'm just going to throw a couple of questions at the panel and I'll open it to the audience. But zeroing in for a minute on this question, the title of the debate, should social care be funded by the state or the individual? I'm struck by Warwick's argument, given that you're essentially a Thatcherite, you've worked as a special advisor for 3 chancellors, you have the 1,000-yard stare of someone who's worked in the Treasury for many years. But essentially, you're saying that the answer to the social care problem is that the state basically comes in, taxes us, and fixes it. I'm just intrigued as to that sort of apparent contradiction in your outlook.
Well, I became interested in this because I was a member of the Social Services Committee. And it coincided at the time when I was a special advisor to the Treasury when the Griffiths report was implemented in the National Health Service and Community Care Act 1990. And essentially what that did was to say there would be a cap placed on the amount of money that a local authority can actually have for spending on care, and it would end the perverse incentive that local authorities had to actually place someone who might manage in their own home into a care setting run by a private company or a charity, because they could have offloaded that onto the housing benefit budget. So some people wound up who didn't want to be in a care home, didn't need to be in a care home, being put into a care home because the council, instead of paying it for themselves, could put it onto the social security budget. So that was a good thing to change. But it was a very convenient thing for the Treasury, I was pleased by this at the time, as a way of actually capping overall expenditure. And I then saw, in the 1990s, this very astringent cap on the amount of money we were putting into the system. And I slowly saw more and more households actually having to pay these very high bills in an expensive part of central London, where you would think they'll be well able to do so, but they had a lot of difficulty. Now, at the same time, Mrs. Clinton was putting through her healthcare changes in the US. And it became clear to me that it was very odd. We do free care for seeing your GP. We do free care for the things you could take out insurance, like having a hip replacement, your cataracts done, something like that. In principle, the insurance market can actually work there because it's a precise, discrete event that comes to an end. The things that insurance will not work for are chronic conditions that carry on for years and years, largely things associated with healthcare in old age, but certainly all social care. And I find it very entertaining that British politicians, British ministers in both parties have amused themselves by exploring an insurance market that will not work. Now, we've just seen for 8 years in the United States, the Obama administration pursue an Affordable Care Act, which is giving insurance to skint people who can't afford to pay for it. And it hasn't worked in the United States. And in the same way, trying to construct a social care insurance will not work here. And it's not an accident that the United States has Medicare and Medicaid that effectively has a very, very generous means test because they can't make it work.
Thank you. I'm going to ask one last question before I open it to the floor. And it's a sort of intelligence question, I guess. What are you hearing, Camilla, that around conference about the social care green paper? Is it coming? I'm sort of hearing maybe before Christmas.
Which year?
Yeah, 2020 something. But more to the point, why is it taking so long? Is it just Brexit that's distracting the government? It means they just can't do it.
What am I hearing about the social care green paper? Nothing.
Yeah, okay.
Is my answer to that. Well, I think there were some initial whispers about it, and we did stories about it, and there were concerns that it didn't address some of the major issues because the whole problem is just an absolute nightmare to solve. And also, I think, as has been the case and has been illustrated by conference, Brexit is overtaking everything, and there isn't much room for domestic policy. And equally, it's easier to make domestic policy announcement on housing and other sexier subjects than trying to grasp a nettle that is, as you've just explained, difficult to try and reconcile this idea of whether it should be state funding, insurance, a mix of two, but also for Conservatives to start suggesting that people should be paying for social care is an easy attack line for Labour. So the whole thing's #orcs, as they say.
Thank you. I will take questions from the floor. If you could just keep your questions relatively brief and a question mark at the end of them, that would be fantastic. We'll start with the two gentlemen on the right there.
Mine is very quick. I like the ISA idea. Graham Jones, West Lancs, great idea, ISA.
Great. And the gentleman behind you.
I think there has to be a mixed solution. People who've got money should pay, but at the moment the payments are draconian, and you spend all your money before you get state aid. So the proposals last year were a great improvement on the present situation, which is intolerable. But I do question, both parties have said that nobody should be able to have to sell their house. Loans can be taken against it and paid after they die. Are we really happy to end up with more and more houses falling into disrepair? We've all got them in our cities and in our streets and wards because people aren't selling who don't need to sell, and we'll end up with more of those, a housing shortage and dilapidated houses. That isn't a sensible policy, and both parties seem to have said no one should have to sell their house. Well, if no one's living in it, it might be something should be done with it.
Okay. I'll just throw that one at Bob, and also just ask him. We basically, I think everyone on the panel agrees, we need a cross-party consensus for the solution to social care. What's not to like about basically a tax and spend solution, the sort that Warwick's proposing?
Well, I think there's a number of factors. I think the concept of an ISA is a very good one. I think it's something that people understand and would find a way of generating a pot of money that's then tax-free, that then can be used for care when it's required. One of the other areas that I think, certainly in my local area, I was made aware of this by the Prominent Housing Association in my area, who've come up with a plan that say to elderly people, we'll take you in to the care home, and then you keep the asset of your home, and we rent your family home out, and that funding then pays for your care. But because one of the crucial issues is the sale of the family home means it's then used to pay for care, and it's not passed on to the relatives that want to keep it. But actually, this is almost the ideal sort of model, because we have another challenge in the sense that we have lots of people living in family homes where the family has moved out, and there's a 3 or 4 bedroom house, and there's 1 or 2 people living in it. And at the same time, we have a desperate need for family homes at affordable rents. Well, actually, that's almost, I think, an ideal way of delivering part of the solution. But people are nervous about it because they think, oh my goodness, someone else is going to take over my home. It's not actually that way, but I think it's a way of doing it. I think I have a great reluctance about hugely increasing taxation for the state then to provide care. I mean, I just have a natural reaction to that, because the Chancellor's had to find extra money each time, but we are getting to a point whereby we've got to make decisions on this. It's not an option to say, oh well, and the problem's going to be, I suspect, and I'm not sure how the Chancellor's going to solve this, is the baby boomer generation that we're talking about, that is probably going to go on living into 85, 90, 100. We've got more centurions now than ever before. Those people are going to increasingly be frail and require increasing funding, but they've retired. They're not earning anything. So are we going to then, this is the challenge, I think, are we then going to tax them on their pension plans or whatever they've got in order to pay for their care, or are we going to say to younger people, you need to pay even more tax to fund the older generation? Then we have the challenge, which I think is key here, is at what level do you set before you start charging people? What asset level or what income level, and where's the fairness in that? So if you've saved all your life for your old age, you get penalised. If you've been just spent all your money, throw yourself on the state, you'll be looked after. What message does that send to people? And
Quickest point on downsizing, which was something that it wasn't looking like it was going to be tackled in the Green Paper, is what about a tax incentive for people to downsize with a reduction in stamp duty to free up those properties, and also not have older people rattling around in houses that might be too big, which then contribute to the care crisis because they're falling downstairs and getting cold and inadequate accommodation.
Thank you. I'll take another couple of questions. The lady there and in the middle there.
Steph Kenyon from the Association of British Insurers. The debate has been really interesting, and agree, I think, with most of the comments that there isn't one fix-all solution. But I think before we start talking about funding and insurance models and state care and where you set caps and floors, there's a big understanding gap. So we did a survey that found 85% of the population had no real awareness or were completely misled on the cost of long-term social care. And I think before we agree what the solution is, there's a greater awareness that really needs to be developed. And I just wonder what the panel's views on how that can really be addressed, and whether they are optimistic that the Green Paper will address that.
Thank you. And a question here in the middle.
Oh, sorry. Thank you. Jane Edwards. I wanted to address the IT solutions that were being talked about. My next door neighbour is totally immobile. She never actually had an electric kettle or a toaster. And she has one of those chairs with the buttons that move, but she's scared to use them. There is lots of solutions in the future, but I think there's a generation out there that just won't benefit from any of the IT. And I also think that we could do more to plan having sort of intranets that are more based around doctor surgeries that actually are more intimate. You know, 1 billion people is great, but if you don't know any of them, it's nothing, is it? So making something that's local and intimate and it glues the community and decreases loneliness and allows volunteering, I think that's the way to use IT. But yes, I think for your generation maybe, but trust me, when you're 80, they don't want to press any buttons, certainly not Uber.
Thank you very much. I might ask Julia and then Benjamin to answer the first and then the second question, if you see what I mean.
Yeah, okay. I agree with you entirely. I really do not think people understand the social care issue until you're actually in the middle of it, dealing with it, and by then you're having a nightmare. So I do really feel that we have to get that message out to the public with a much greater understanding of what the problems are and what the actual costs are. Because I do think they need to know that. But equally, I just wanted to say as well, we've had, through a housing association, like a village that's been built. And it's been built on a principle of thirds. A third you can privately buy. A third, it can be a housing share. And the third is for rent. And equally, the people that go to live in this accommodation, they've got the facilities. As a person gets worse with the condition that they've got, they can provide the care. And I think alongside the funding issues, we need to look at the accommodation too, because this is purpose-built, you know. But there you go.
Thank you. Benjamin.
Thank you for your comments. I agree actually with large parts of them. I think I'd say 3 things. And the first thing I would say is that I'm very uncomfortable with the idea that social care is only for people who are old. I have a real problem with that because I just don't think it's borne out in the statistics and it's not borne out in my life experiences. So of the 1.8 million people who asked for social care in the last year, around a quarter of them were actually aged between 18 and 65. I think for that particular demographic, we have to remember one thing, which is that they're more likely to deplete the entirety of their assets than somebody who's old. Because actually these people are going to have to be on care for the rest of their lives. I think it's very, very important to remember that I could, age 21, drop dead with drop down with a stroke any second, or have rheumatoid arthritis, or something that could last for a long time, and that deplete all of my assets at a very, very young age. And I think particularly for demographics of people who have been sort of in work and suffered debilitating illnesses in the long term, they're very often the breadwinners, and you're even more likely to suffer this problem. The second thing I would say is that, which was the criticism about old people not essentially being able to use the technology itself. That's a challenge for technology makers. And I think that this is an area where the Internet of Things can actually really come into its own. So when you are able to speak to Alexa and give it voice commands, rather than be able to have, rather than having to fiddle with it on an app, actually that's a really good example of something that's able to happen in that respect. And I would say one final thing, and this is a question more about monitoring, which is we're currently in a situation where we spend a huge amount of money sending people around basically to check up on people 3 times a day. And DeepMind very recently partnered with the NHS to deal with people with acute kidney illnesses. And essentially they set up monitors based on people's blood levels, and when they had acute kidney injuries and they looked like they're going to be in serious problem, it would send an alert to doctors and they go out immediately. That's a much better way of dealing with things. It's much more low cost and doesn't really require any real effort on behalf of the sort of old person in order to do it. And the other area where you're going to have really good things are sort of there are in Japan lots of very interesting technologies that make sure people take the right amount of pills, that stop the administering of pills if they think the blood levels got too much. I mean, these are all areas where we're going to increase productivity. But I would just reiterate the theme of all technology stuff, which is we're not going to solve these problems, which have been very, very well described by the other panellists. We're not going to be able to implement the technology unless we get the funding right.
Thank you very much. I'll take 2 more questions from the 2 ladies here in the front row.
My name is Nita Sangara, University and College Union. I'm really, really pleased to hear that you're talking about the actual care workers, because they just get lost. I mean, here in Birmingham, the care workers have been on strike since February because of the absolutely awful conditions imposed by the Labour Council. I'll just add that. I really, really welcome the fact the potential of the state funding social care, amazing. The question of individuals putting something into the pot, can I just say that we have an increasingly precarious workers. We have precarious workers which are increasing, and they don't know from month to month what they're going to get. So a lot of them can't even afford to put into their pensions. So how are they going to afford anything for ISAs or something to put in the pot towards their care package? So how would you deal with them?
Thank you.
Thank you. Andy Bedimer from Dimensions. We are a support provider working with adults who have learning disabilities and autism. I'm really glad that, Benjamin, you brought up this point that actually there are a lot of working age disabled adults, around 280,000 at the moment, who need social care to live independently and who haven't really appeared in a lot of the debates around social care across conference so far. The government green paper initially suggested that this would focus on funding social care for older people and exclude working age disabled adults from the conversation altogether. My first point really is there a different equation of fairness around funding care for people who have lifelong disabilities? And the second is, if we're truly going to move to a system of integrated health and social care, particularly those who have lifelong complex health and care needs, do we inevitably end up with a system of social care that's free at the point of use?
Thank you. Warwick and then Camilla.
In terms of realism about what individuals can contribute to a savings pot, I think we're inviting individuals to buy houses that are much more expensive. We know that individuals can't actually save properly through the pension system. You have to put in about something like 15 to 17% of your lifetime earnings to actually get a pension that's going to be reliable with the kind of charges we actually have. If you actually go down the ISA route, what are you going to do when the ISA hasn't got enough money in it? And sometimes, actually, there's variability of return in an ISA, and it turns out you actually go into the home and the money's gone down. So I really do not think this is a realistic, actually, route to do. The very complex way of actually letting out properties, I have a very valuable flat in Notting Hill. If I were to let it out, there wouldn't be enough money to pay for long-term care. It just wouldn't yield a rental income sufficient. By the time we've applied tax to it, it will be even less. So I really do think we're exploring interesting mantelpiece dimensions that will not apply to actually dealing with the real issue. In terms of young people and care, for me, you've touched a raw nerve. And I want to just say something about care has got better in the last 40 years. When I first knew about long-term care, I was a general messenger in a hospital in Plymouth, where a significant proportion of people went into geriatric wards, Nightingale wards in district general hospitals. They were very unpleasant places to be in. You had people with dementia, people with other physical disabilities who didn't want to actually be there. Often it was because they couldn't get into a local authority home that wasn't often that well run or inspected. So we've come a very long way. But I've never forgotten the young man in that ward who was about 27 years old, sitting up in bed, and I said, "What's he doing here?" He had early onset dementia. He was bright, had a smiling face, he had an extremely difficult diagnosis. No way should that young man have been in that setting, and I'm delighted to say that increasingly that is being done much better than before. The other thing I'll say about young people, we have a colleague or a former colleague at Policy Exchange whose best mate had a stroke in his 30s. They have had an absolute nightmare navigating the system, and they are slowly being cleaned out of assets in order to actually manage his care. So I don't think you can make a distinction between the older people and the younger people, and the only way you're going to actually do it is to recognise there is a need. It has to be free at the point of use, and it's got to be done by a reliable, buoyant, recurrent source of revenue from an expenditure tax like VAT or a source of income like income tax. And politicians and policymakers who dance around this and explore other options are merely kidding themselves.
Well, following on from that as well, I think that we're questioning whether some care would be covered by the NHS when it comes to perhaps the under 65s. In the case of, you said you were looking after people with autism and learning difficulties. My own personal experience of that is a friend who has a child who has Down syndrome and is constantly in and out of the NHS, which is sometimes a successful and rewarding experience and sometimes deeply frustrating and beset by problems and delays. That then explains, because we're all kind of racking our brains as to what we think might be covered by NHS care. You're talking about rheumatoid arthritis in a 29-year-old, you would hope would be able to rely on the NHS for that kind of care. But that we're even questioning what's covered by NHS and what's covered by social care. It's then no wonder, is it, that we're kind of all tootling along, thinking, you know, mum and dad will be all right if they get ill because the NHS will cover it, only to discover that they probably won't be. When it comes to the issue of carers, what's interesting about the private sector, and just in my father's own experience, you know, at the end of the day, the best care homes, like most businesses, are founded on its employees, providing care because they are being nurtured and trained. And actually, the public sector can learn from some of the best care homes in terms of best practice. At my father's home, you know, it's not just providing nursing care, but it's also a centre of excellence for teaching nursing. And we've had young girls coming in as care assistants who have gone on to do their NVQ training within the home to then get further on in their careers. And it's developing young men and women in healthcare, which is obviously hugely important. But you know, we're talking about obviously a care home in the private sector where the fees are higher, and my father can afford to make that investment. And obviously that's problematic. And I do think that there needs to be a bit more recognition. You know, often we're talking about huge amounts of support for frontline NHS staff and nurses, and you know, we will remember from the last election campaign that Theresa May came quite unstuck when she was challenged on nurses' wages, because there's an innate kind of protection. And sometimes care assistants do seem to slip between that gap, and there isn't the recognition of the extremely vital role they are playing, not just in society, but such an intimate role they're ending up playing in families' homes with their own parents, that is actually more intimate at times than people who are having one-off visits, even to acute care in hospitals.
Well, following on from that, a final question, and I think we'll draw to a close. But there's an announcement today from Matt Hancock, the Health Secretary. £240 million will be pumped into social care in England to ease pressure on the NHS. And it's always the case that when people are talking about more money for social care, what they're really saying is social care is having a massive impact on the NHS, and by fixing social care, you will alleviate some of the pressures on the NHS. Do you think, Bob, just a concluding remark, that basically tying together social care and the NHS might be key to solving this whole problem?
Yeah, well, yes, two things. If I could just actually take the young lady here
Please,
that raised the issue of younger people. I can tell you my sister has been in residential care since she was a child. She's now, later this week she'll be 59. I talk about the huge cost of that to the state, effectively, is horrendous. And I've seen it firsthand, young people in particular that have gone through that. We have to face up to the fact that medical science has advanced so much that people that would have died in infancy now proceed to adulthood. And for a local authority, and this is, I think, the big challenge, for a local authority, if a family move in, that can easily consume £100,000, £150,000 a year in care costs. So we have to find a solution to that particular issue and not expect a local authority to pick up the tab. In terms of what the other problem that we do face is, and I've seen this at first hand in hospitals locally, is in the care homes, because they're not providing medical care, someone who's elderly, who's vulnerable, gets ill, they call the ambulance takes them off to A&E, they patch them up, send them back, and it's like a yo-yo effect. Actually, what we need is the facilities in the care homes to provide medical care there and then, so that people don't have to suffer this yo-yo effect between A&E and the care homes. That requires funding, and it requires a stream of funding, a proper assessment of what the need is, and then funded through taxation to ensure that those people that are in those conditions are helped and assisted. And my worry is what we're keeping doing is 6 billion, we find that, right, that will fund adult social care for a time, 240 million, which is, frankly, in this industry, a drop in the ocean.
Yeah.
And all it does is put a sticking plaster over the problem. We actually have to have a solution to this.
Thank you very much. I think on that note, we'll draw to a close. Thank you for coming, and thank you very much to all the panellists. You've been fantastic.
Thank you.